Mr. President, I rise today for the third time this evening on behalf of Wisconsinites in rural communities whose access to health care will be devastated by cuts to Medicaid. Earlier this evening, I talked about the impact that cuts to Medicaid would have on children and babies, and then about the impact that cuts to Medicaid would have on seniors and older adults. But in my home state of Wisconsin, about a quarter of the population lives in rural areas, or roughly 1.4 million people do. And across the United States, about 60 million people live in rural areas. And when I travel around Wisconsin, I hear about several challenges that our rural communities face, from the lack of high-speed broadband to ensuring businesses have enough workers to thrive. But the number one challenge that I hear about time and again is about rural access to health care. Wisconsinites in rural communities face long drives and wait times to see a doctor. And for specialized health care, many of my constituents are looking at hours in the car just to get the care that they need and that they deserve. That's why I've made it my mission to lower health care costs and expand care across the state, but especially for critical access hospitals in our rural communities. I am proud of our work because I know what a lifeline our rural hospitals are for Wisconsinites, from emergency care to having a place to get regular checkups. But I know we have work to do. In the past 10 years, 120 rural hospitals have either closed or ceased offering inpatient services across this country. That's 120 communities and hundreds of thousands of people whose health care options have diminished or vanished overnight. Most recently in the state of Wisconsin, the closure of 2 HSHS hospitals and more than a dozen, well over a dozen clinics in western Wisconsin left 1,400 workers out of a job and thousands of Wisconsinites with less access to emergency care, inpatient beds, mental health care, treatment for opioid addiction, and labor and delivery services. Nearly half of all rural hospitals nationwide operate at a deficit, especially in states like Wisconsin that have not taken up the Affordable Care Act Medicaid expansion option for adults. In a struggle to keep their doors open, many rural hospitals opt to close less lucrative units, such as maternity wards. That means women driving further for prenatal checkups or to give birth. For the hospitals left and places that provide care, there's largely been one saving grace: Medicaid. Medicaid, and Medicaid expansion in particular, is a crucial funding source for cash-strapped rural hospitals. And it makes sense. Children and people in rural areas are more likely to be enrolled in Medicaid than those in suburban and urban areas. In 10 states and territories, more than half of Medicaid and CHIP enrollees live in rural areas, including 1 in 3 children in Wisconsin's rural communities. Medicaid ensures access to a critical range of services for people living in our rural areas, including covering nearly half of all births. And like other states, our rural hospitals are already too few and far between. Closing any more down would be devastating for people's health and our economy. But those are the consequences we face if Donald Trump and Republicans cut Medicaid to pay for their billionaire tax cuts. It's not just blue states. It's not just big cities that should be bracing for impact if Republicans get their wish. Massive cuts to Medicaid will undoubtedly force more rural hospitals to shutter. That means more Americans suffering from a stroke or heart attack, not getting the life-saving care they need until it may be too late. That means more children in rural communities not getting to regular checkups, and it means more expectant mothers facing roadblocks to getting prenatal care. Let's be clear. The health and lives of rural Americans are on the chopping block if Republicans and Donald Trump pass their plan to gut Medicaid and all to make the super wealthy Americans even richer. It's wrong, and I, for one, plan to fight back. I yield the floor.